bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, and the McMaster Children's Hospital Foundation. We would also like to thank the following Keystone partners for their ongoing contributions that support all of CAFC's programs and activities:
All right, hello everyone, and welcome to today's episode of CAFC Presents. My name is Doug Maynard, and I'm the Associate Director at CAFC, the Canadian Association of Pediatric Health Centres. And welcome to today's webinar, which is titled Protecting Youth Mental Health, Practical Strategies for Violence Prevention. And once again, we're very excited to welcome our colleagues from the CYCC network back to join us today. But before we get started, I just have a couple of announcements. First, I want to make sure everyone is aware of the upcoming CAFC annual conference that's being held this year in Calgary, Alberta. Our theme is Climbing Mountains, Leadership and Resilience in Pediatric Healthcare. And we have a great lineup of speakers and activities that includes country superstar and hometown hero in Calgary, Paul Brandt, and former pediatric nurse, for those of you who didn't know that. All of the information about the conference can be found on the conference site at conference.cafc.org. So we hope to see everyone there in person. We see each other every week on these webinars, but at least we'll be able to see everyone's faces if you join us in Calgary. So we hope to see you there. As always, we take questions at various times throughout the webinar. We have 4 speakers today, so we'll be taking questions throughout the webinar. So please, I always encourage everyone to type their questions into the question box as you think of them, so that we have the questions ready when it's time to present them to our panel, and we don't have to wait for people to get their fingers flying on the keyboard. You are free to come and go from the session. It doesn't interrupt the session, and we do record the entire webinar, so you can always go back to catch up on any parts that you may have missed. We do have an hour and a half scheduled for this, and sometimes the question and answer period goes over time a little bit, but if you do have to leave, again, you can always come back during any part of the session, and you can always come back to the recording, as we do record all of these and post all of the information, so including the audio-visual recording, PDFs of the presenter slides, if they're made available to us, etc., are all posted on the CAFC Knowledge Exchange Network, and you can find that at www.ken.cafc.org. Takes a couple of days to get that information up usually, and will receive an automated message from the webinar system that will provide you with a direct link to that page. The CAN does also provide for comments for people who have registered users on the CAN. At the bottom of each page, we encourage you to post a comment there if you want to continue the discussion following this presentation, or post any other information that you think would be of interest to the audience or anyone that's interested in this kind of content. So with that out of the way, it's my pleasure to introduce our panel today. And as I mentioned, we're once again excited to welcome back our colleagues from the Children and Youth in Challenging Contexts Network, the CYCC network, which you can always find much more information about all the great work they're doing at cyccnetwork.org. But with us today, we have, once again, we have Lisa Lachance, who's the Executive Director of the CYCC Network, which is a knowledge mobilization network that was created to improve mental health and well-being for vulnerable and at-risk children and youth in Canada. And with us, we also have Judy Fairholm from a CYCC network member organization, the Canadian Red Cross. Judy's a director at the Canadian Red Cross and was spearheaded the growth of their Respect Ed violence and abuse prevention program. And she led that from a grassroots initiative to a national award-winning program that's now in 28 other countries. So we're excited to welcome Judy to the presentation. We also have Dr. Christine Weckerl, who's an associate professor in pediatrics and an associate member of the Offord Center for Child Studies at McMaster University. And Dr. Weckerl's current research focuses on child welfare populations, particularly adolescents who are receiving child protection services. And as I was mentioning about the CAFC conference being related to resilience, Christine is also an expert and brings an expertise in the area of resilience in children, and will be part of a presentation at the CAFC conference on the research in the area of children's resilience. We also have joining us Dr. David Esty. David Esty is joining us from the Faculty of Social Work at the University of Calgary, where he focuses on social work practice with immigrants and refugees, management of human service organizations, qualitative research methods, and mental health. And Dr. Esty is involved in a number of national multi-site research projects, all of which you can find on his bio page at the University of Calgary site. He's got a whole list of all of his research activities there. So with that out of the way, it's my pleasure to once again hand the virtual podium over to Lisa Lachance to kick off this session from the CYCC network. Over to you, Lisa.
Thanks very much, Doug, and hello to everyone. So as Doug mentioned, we're the Children and Youth in Challenging Contexts Network, and we're a national and international network funded by the federal government through the networks of Centers of Excellence in their Knowledge Mobilization Program. We bring together people and organizations who support the mental health and well-being of vulnerable young people. We want to work with our members to identify what works for these young people, capture it, share it, and help others use these promising practices. We're based at Dalhousie University and build on the work of 3 research groups. Michael Ungar is our scientific director, and he is also the co-director of the Resilience Research Center. We also were founded with the Center of Foreign Policy Studies here at Dalhousie and the IWK Children's Hospital Center for Research on Family Health. The leaders of these organizations created this collaboration, recognizing that what works for at-risk youth in one context could often be just as effective in others. And I knew that by remaining isolated, we are likely to keep repeating mistakes, seeing the same challenges, and keeping solutions to ourselves. For us, challenging context includes exposure to violence through war and displacement in their families or communities or amongst peers, such as in gangs. Our concept of vulnerable children includes those who are in alternative care or detention, who are working or who have been trafficked. And we also think of those who experience marginalization and oppression based on their community or their community's identity. I mentioned that we are funded to do knowledge mobilization. Traditionally, this is focused more on moving information from academic research into practice. In other words, evidence-based practice. And this is important. We don't want valuable research sitting on shelves when it could be making a difference for young people. But what we find is that the community service providers, who are often on the front line providing services to vulnerable young people in Canada, often have limited, if any, access to academic journals or relationships with researchers. We also want to look at the types of programs that they're doing that are making a difference in the lives of young people. We call this practice-based evidence. So we want to help service providers evaluate, analyze, capture, and share their promising practices with others working in the sector. So our model has been to bring together evidence-based practice, practice-based evidence, and to augment this with local knowledge through local case studies. We do this throughout the work of the network, and today you'll hear about how this approach has been the foundation for our knowledge synthesis reports. In 2013, we completed 3 knowledge synthesis reports, one of which you'll hear today on coping with violence. We also looked at using technology to provide support to children and youth in challenging contexts, as well as looking at youth engagement. And we, as an organization, value youth engagement and to include the young people who are accessing services to make changes in the system that serves them. This year, we're looking at 4 new topics: violence prevention, which you'll hear more about from Judy. We're also looking at what are the ethical issues and approaches in conducting evaluations of interventions with children and youth in challenging contexts. We're looking at the information-seeking behavior of children and youth in challenging contexts. So how do these youth access mental health information, and which pathways are likely to be most helpful? And finally, we're looking at supportive environments. What kinds of services and supports work best for children and youth with complex needs in challenging contexts? So how else are we using a network to get the word out about what works for vulnerable young people? We have built a national and international network with over 150 members from across the sector, including researchers, healthcare professionals, community organizations, government officials, and youth. From the moment they become involved, network members start sharing their best practices in our online database, as well as putting their profile on our website. We also want to support our members and their work in doing knowledge mobilization. We've offered knowledge mobilization innovation seed funding to members. In total, we funded 15 projects across the country. And they include a range of projects that engage Aboriginal youth in digital storytelling. There's one project with Red River College in Winnipeg that's working with youth in care to develop training videos for child and youth workers, and a number of other interesting projects that you can find out more about on our website. We also know that a major challenge for a lot of community service organizations, of course, is to develop their own evidence base, to evaluate what they're doing, why is it working, if so, how is it working, and that's really the basis for being able to share promising practices across the sector. One of our founding members, the Resilience Research Center, has developed an evaluation tool basket. It's really an amazingly easy set of tools to use, but we also provide support to our members to help them get started in evaluating and sharing their best practices. We also try and meet with people from across the sector across Canada. In 2013, we launched Wisdom to Action. This is a series of events that bring together people from across the sector and local communities to talk about promising practices and consider new ways of working together. To date, we've hosted 5 of these in Toronto, Ottawa, Halifax, in Surrey, BC, and last week in Iqaluit, Nunavut, and will be in Montreal in November. Finally, we do maintain a very vibrant website where you'll find our members database, our promising practices database. We also have a YouTube channel that has over 43 videos and includes a number of profiles of best practices. So finally, I'll turn it over to our panelists, who are all working with us along with our other members to develop and strengthen our network across the country. We want to leave a legacy of people and organizations better connected to the knowledge and practices that help the children and youth that we serve. We know that you know how to help kids do well in their lives, and now we want to share that with each other.
All right, thanks, Lisa. Now we're going to move over to head west out to Calgary with Dr. Dave Esty. So over to you, Dr. Esty.
Well, good morning, and I'd like to thank the organizers for this opportunity to be part of this webinar. I've been involved in research projects since its inception. I've known Mike Ungar for about 15 years, and I believe he asked me to be part of the team because I've done quite a bit of work in relation with immigrant and refugee youth and Black youth. So I have the daunting task within 10 minutes of summarizing, as Lee says, one of our knowledge synthesis reports. And the essence of these reports is to bring together examples of best and promising practices for working with young people in challenging contexts. And the report that I'm going to summarize is entitled Promising Practices to Help Children and Youth Who Have Been Exposed to Violence. And the specific goal of this particular report is to showcase what researchers, practitioners already know in helping young people to cope in the face of violence. And so what we did is that we did extensive literature review in relation to research, grade literature, as well as understanding through case studies, local examples that could help us and come to some determination in terms of what were the best practices. We had a great team. We had 2 great research assistants, and then you see the rest of the team listed on the second slide. So what is violence? And we basically, and there's lots of literature and a lot of different conceptualizations of violence in the literature, but we're basically using the World Health Organization, and I'll just read this for you. Violence is conceptualized as the intentional use of physical force or power, threatened or actual, against oneself, another person, or against a group or a community that results in or has a high likelihood of resulting in injury, death, psychological harm, maladaptive, and deprivation. This definition includes direct displays of violent behavior, while self-inflicted, interpersonal, or collective, as well as threats and intimidation. In relation to violence against children, it is not only a national problem, it's an international problem, and as depicted in the first sentence. And in some countries, between a quarter and 50% of all children have reported severe or frequent physical abuse. So once again, it's a very, very serious problem. So what is the impact of violence? So we conceptualize it. It has a lifelong impact on on mental health and mental health of not only children, but their families and other significant others in their lives. Exposure to violence can result in post-traumatic stress disorder, depression, anxiety, substance abuse, risky sexual behavior, etc. Exposure to violence can also result in a greater tendency to exhibit aggressive behavior towards one's peers and the intimate partners. And we do know that intimate partner violence is a very, very major problem in Canadian society. But when we think of the impact, it's not only on mental health, but there's a tremendous financial burden that's placed on families, communities, and nations. And in Canada, the economic cost of child abuse to both individuals and our society in 1998 was estimated to be $15.7 billion. And child maltreatment is linked to higher rates of social assistance, unemployment, lower peak earnings, higher health care, and sickness allowance costs. So once again, we need to come up with programs and strategies to deal with this phenomenon of violence. So, based on the literature, there's two broad strategies. And the first one is promoting mental health and looking at it from an individual relationship and particular context. And for these three, the emphasis is on resiliency and, in particular, trying to identify the strengths that individuals have and that they could use to help them deal with their situations, the importance of strengths in terms of relationships with family, peers, and others, and also because we all live in different environments that overlap, we need to examine what are the strengths in our particular context or specific context that could help us in promoting mental health. And given that Canada increasingly is a very, very diverse society, we need to ensure that all of our programs are culturally relevant, culturally specific, and address the needs of all Canadians in our society. In terms of preventing mental illness, once again, we see this through our scoping review in terms of individual programs that attempt to change the individual's behavior, programs that are designed to enhance and strengthen both family and peer relationships, and programs that are designed in terms of addressing some of the contextual problems, whether it be racism, discrimination, lack of meaningful employment opportunities. So very, very important in preventing mental illness. We also talked in the report in terms of some promising mental health treatment approaches, such as first response debriefing, trauma-specific cognitive behavioral therapy, or better known as CBT, child, parent, and family therapies, and yes, the use of medication when required. So, the final part of my presentation is to share with you what we extracted from the literature in terms of helping children and youth who have been exposed to violence. So, number one, we feel that an integrated, multi-level approaches to mental health care are essential in addressing the complex needs of children and youth in challenging contexts. Two, and I've stressed this earlier, strengths-based approaches to mental health promotion, prevention, and treatment to build protective factors among at-risk youth and their families and communities. Three, interventions need to be relevant to the needs of at-risk young people from diverse contexts, cultures, and genders. Professionals, we can't do this alone, so we need to engage young people, families, and communities in the development, conceptualization, implementation of the programs that are out there, because we believe that this strategy will result in more effective services that will begin to deal with the issues that arise in terms of violence. Number five, definitely have to engage in program monitoring and evaluation, because once again, it's not a question of having more programs. We need to assess whether or not how well our programs are doing and if we need to make adjustments. So once again, we want to make sure that we have quality programs that are addressing the needs and concerns and will provide the supports that are required by children, youth, and their families. One of the joys of being part of this network is that we have an opportunity as researchers, practitioners, family members, and youth to contribute to knowledge building so that we can learn from what other people are doing and is working well. And finally, number 7, we need to make sure that the work that we're doing is done in an ethical framework to prevent further stigma and further vulnerability and risk for young people. And once again, this includes when we are working with them in research and evaluation, and one of the synthesis reports that we're working on in the second round deals specifically with the issue of ethics and research. Thank you very much.
For a great presentation to kick off the session here. So now we're going to move over to, and just as we're moving over to Judy Fairholm, just a chance to remind the audience to type in those questions as you think of them. We're just getting into the presentation, of course, so there's no questions right now. But remember to start typing in those questions as you think of them, and we'll be sure to start answering some of these questions at the next break. So, so now we're going to hand the presentation, the virtual podium, over to Judy Fairholm from the Canadian Red Cross. Over to you, Judy.
Okay, thank you very much, and good morning from Vancouver. I want to start off by saying that one of the reasons that we've been involved definitely with CYCC is because of the work the Canadian Red Cross does through the Respected program and our educating of, now we've educated 6.5 million children, youth, and adults on violence prevention. So when the synthesis report about violence prevention for children in disasters and complex emergencies came up, I was thrilled, because I think when we look where children are at and where we look at the most vulnerable, we have to go to what's happening with children in these situations. So Dave did a nice job of giving the definition of violence from the World Health Organization, and this is the typology of violence that I think is really critical that we understand, that the typology shows that when we're talking about violence, we're talking about all types of violence, but we're also breaking it down into self-directed, interpersonal, and collective. And then if we break this down even further, we can see that actually the most common type of violence that's happening in the world is self-directed. So suicides make up the most common. They make up 58%. That means that a person's killing themselves every 40 seconds. This is followed by interpersonal violence, and collective violence, which is what we hear about all the time, is about 6%. So what is happening to kids within their relationships, in their families, in their schools, in their communities is really critical in interpersonal violence. And then the outcome of that, which Dave was talking about, the mental health and the number of kids that are committing suicide. As I'm sure most of you know, that in the north, our suicide rates were second in the world in Canada, only to Greenland. So we have a significant challenge here. Now I want to just go broader, and I want to look at the countries. You know, there are 58 countries with violence deaths higher than 10 per 100,000, which makes it epidemic. The 3 countries with the highest homicide rates in the world among children and adolescents are in Latin America and the Caribbean. So we have a significant number of countries that have the violent deaths. And I also want to just highlight that when we're talking about violence and we say 1,600 per day, no, 4,200 per day, or 1.6 million a year die from violence, those are the ones who die. And we know that 20 to 30% of people end up in the hospital, so that the the weight of violence on our world and on these different countries is very high. If we look at natural disasters, we can see the trend here of natural disasters. It went down somewhat in 2011. I don't have it up to 2013, but it is considerably, as you can see, since the 70s and 80s, disasters have gone up really high. So we need to keep that in mind and understand that there are basically disasters that are called acute disasters, there's chronic, there's urban disasters, and there are protracted disasters. So we need to understand what's happening with kids in these situations. Basically, in 2013, there were 51.3 million people were displaced. That means that there's 32,000 people per day that are leaving their homes and that are seeking protection. Of these 51.3 million people, 50% of them are children. So we have children, over 25 million children living in these types of circumstances. About 8 million of them are refugees, about 16 million of them are internally displaced, and so they are kids who are having to leave their homes either for disasters or complex emergencies such as conflict. This is a whole population that we haven't looked at really clearly on how do we protect them from violence. And this paper, this synthesis report that's coming out is looking at that specifically. Why does violence increase during disasters and complex emergencies? Well, there's a whole number of issues that are happening. It can be the nature of the disaster and the emergency will definitely impact that. The actors and not only the country, the context of where it's happening, but also the people who are coming into that disaster and emergency. And what is the pre-existing social context and values will definitely impact why that violence increases. And then when you look at the inside the triangle and the risk of violence, you can see that with disasters and emergencies, the social support systems definitely have disappeared. The protection mechanisms are minimal, if any. And so a lot gets left on what is the resiliency and coping strategies, which can be very, very, can be struggling with those as people struggle with everything from poverty to trying to find food to trying to find clean water, etc. So this context is really a critical context where the stress mounts incredibly and then violence starts happening. High risk are girls and boys, both for sexual violence. High risk is domestic violence. So when we look at the root causes of violence, which is the ecological model, and put this in a disaster and complex emergency, you can see that when the society and culture, I'm not going to go through all this because I don't have time, but you can see when there's a rapid social change, when there's economic inequality, when there's poverty, when gender issues come in, when all that's happening, then we know that it's going to go down and the individual is going to be impacted. So if we have 25 million children out there who are refugees or internally displaced, then we know that they are living in this type of environment where the stress is coming down on them very high. I think it's also important to know that when we talk about violence as a public health issue, we also can see that there's a contagion of violence. And as Dave has already talked about violence against children, and the literature and the research is showing greatly that what's happening with children, whether they're abused or bullying, that this can expand into all other things in society and in their lives. So there is a contagion that is happening about that. So what are we going to do about this? This is a huge problem, huge problem. And how do we take this, which I would say is pandemic, and how do we interrupt the transmission of this? And I think when we look at prevention, we need to look at how do we work with individuals and how do we work with bystanders who are aware of what's going on and give them the tools in order to interrupt this. And do we put in place response plans and protection plans within the environment? So within these environments, what do we have in place to protect the children? And then we need to look, how do we prevent further spread of this? And where do we go with secondary prevention? Again, how do we use bystanders and witnesses? How do we integrate violence prevention into everything that we do, whether it's water, sanitation, delivering food, whatever we're doing? How do we integrate that? And a really critical piece is where and how do we engage youth in this? How do we engage youth in disaster preparation, in disaster response, and also in disaster recovery? And then the big thing is, how do we shift norms? How do we shift the norms that adults are responsible for protecting children, not for hurting children? How do we shift the norms that children are the critical element for where our whole society is going? How do we work it so that people begin to own this problem and they own the solutions? And what type of assessments are we doing in physical environments to make sure they're safe? Do we have the water sanitation set up? Do we have lighting? How are we sheltering people? There was a report that just came out this last week from UNICEF, and speaking very strongly about violence against children around the world and what was happening, and then came out with 6 strategies to prevent and respond to violence against children. And the first strategy is to support families, that we need to educate families, caregivers, and parents. We need to really work with the families so that the families become safe families. Second strategy is that we give children and youth the skills so that they can manage risks, so that they know their rights to be safe, but that they know how to manage the risks and what to do about it. Third one, that we change attitudes and social norms that encourage violence and discrimination, so that this big piece of changing those norms again comes up over and over. The fourth one is that we provide the support services for children, that children have a place to go when they are being violated or when they are at risk for violence, that we work on the protection laws and policies, and we not only develop them, but we implement them and we educate around them. And then lastly, or maybe it's firstly, is the data collection, and that this is researched every step of the way. So we have a big problem and challenge in front of us that is growing. Our disasters are growing. The complex emergencies are growing. We have more and more children who are in transit in terrible situations, and who many are unaccompanied and have no one to protect them. But we know about violence. We know it can be predicted and it can be prevented. And I think the critical element is, do we put our minds and our resources to protecting these kids? Thank you very much.
All right. Thank you, Judy. That was a great presentation, really helping us understand the global nature of the issues here. So now we're going to pass the virtual podium over to Dr. Christine Weckerl. She did join us just as we were starting, so hopefully she got everything connected and is ready to go. So Dr. Weckerl, are you ready to share your presentation?
Yes. Hi. Hopefully you can see my screen now.
Yes, we can. Yep.
Great. And thanks so much to CAPC for organizing this webinar. And I want to say a virtual high five to everyone out in webinar land. Thank you for joining and learning about what the CYCC network can offer in terms of being a resource to you, as well as the specific topics we're all going through. And thanks to Dave and Judy for their great overviews of part of what's available. I'm going to be talking today in the next 10 minutes about a specific form of dating violence and some of the prevention programming. Oops, I hope that's all good. Mm-hmm. And in service of the ongoing information exchange, I just encourage people to get onto Twitter because the science communication happens fastest on Twitter. And the CYCC has a Twitter, and I run a Resilience in You Twitter where I put out the research articles and reports. And as we have heard so far, one of the emerging themes is that, child maltreatment prevention is a critical resilience strategy because it can create the context for a cascade of mental and physical health issues. As a recent article in Pediatrics by Clark and colleagues show that not only does child maltreatment directly impact body mass index from adolescence to young adulthood, but it also impacts dating violence, and dating violence itself leads to weight issues in this perspective study of adolescence and young adulthood and later adulthood. So we want to keep in mind that while we are talking a lot about mental health, there are physical health implications. And one of the themes or key messages in what I'm going to be saying is that for providers, the lifestyle decision-making discussions should be happening in adolescence at your well check visits, the immunization visits, and also with specific at-risk groups. And that's part of who CYCC serves. And just a note that an important physical health issue that's being shown is the issue around adolescence and sleep, and everyone who is kind of understands that. But in our research, 60% of the youth with child maltreatment backgrounds have significant sleep onset issues. Keeping those things in mind. And a quick quiz. When we look at teens, we understand sort of that this is a very important period of development. So we have a quick quiz here. By age 15, teens can use advanced reasoning skills. Well, that's true. And part of the brain that controls emotions does not fully develop until the 20s. That's also true. And the adolescent brain is being more sensitive to rewards. That's also true. So you have, in terms of dating or romantic relationships, a sort of perfect storm of having a lot of motivation, being sensitive to those reinforcers of interpersonal support and romantic relations, but having to really work on the emotion regulation pieces of it. So when we think of dating violence, well, sure, having that relationship experience of violence is a predictor as with child maltreatment. It's also very much a time of learning what a romantic relationship is all about. And if you haven't thought about what you want in a relationship, a close relationship, then you're not really going to be well prepared to respond to it. You're going to be more reflexive rather than reflective in your behavioral actions. So dating is an important piece for adolescent development. It also means that this is a good window of opportunity for working in how to relate healthily and non-violently. And recognizing that dating violence, when that occurs, whether it's at the emotional, physical, or sexual coercion level, is a source of stress for that youth. And the definition is a pattern of violent behavior that causes some level of pain. And the focus is really on pattern. So it's not a one-time event, but it's something that's repeated. And in running a relationship violence prevention group, which I'll talk a little bit about, one of the learnings of one youth said that they learned that they could just say no to the partner. They didn't have to give an explanation. They didn't have to do anything other than say the word no. And that was very empowering. So these resilience strategies can be quite simple in our adult eyes, but still very effective. I've put some YouTube clips up. These are public service announcements on dating violence, and you might like to check that out. To understand the scope of dating violence, basically the American Centers of Disease Control has run a adolescent high school survey for decades, and the dating violence question has more or less been consistent in showing that about 10% of high school youth will report physical dating violence victimization. Most youth are dating, but in this last run of the report in this 2013, they've asked about sexual coercion in the dating relationships. And similarly, about 10% are saying that they are experiencing kissing, touching, or forced intercourse in their dating relationships. Most of the time, there is no gender difference, that males report similar victimization than females, but in this particular run of the survey, females were higher than males. That's Canadian data, maybe coming from BC, the adolescent survey. And in the 2013 survey, unusually a fairly low number of youth were dating. That was much lower than their previous survey. So only 39% for dating, and consequently you have a lower percentage of victims of physical dating violence. And we know, as Judy mentioned, violence kind of clusters together. So child maltreatment victims are more likely to bully and much more likely to be bullied. And dating violence victims are also more likely to report having been bullied. An interesting sort of twig as we look for red flags to prompt us to ask for more questions when we do our screenings. Youth who report having no close friends were more vulnerable to dating violence. And also youth who identified that their friends had sort of antisocial viewpoints. They didn't mind if knowing that their friend beat up on someone else, were more likely to report dating violence. And we know that youth who are just involved have much higher rates of dating violence. So we are just providing that sort of key encouragement to professionals in terms of the anticipatory guidance that they are providing, the routine health maintenance, and the guidelines for reporting maltreatment, that adolescent dating violence is a significant issue, but not one that's often queried about. There's another resource there around the red flags and the rights approach to dating violence. That's really the approach that the Youth Relationships Project, a indicated prevention program that I've been involved with, takes. For the first thing we do is talk about the individual rights, because for some youth, they've neither thought about it or they really haven't experienced challenges to the rights. Remember that dating is a new behavior, so you can walk into a situation where you're experiencing violence because, just the virtue that's a new behavior. You don't have that context of experience to help you understand when someone's being, very controlling emotionally, that you don't understand that controlling behavior as that they're very, very into you. And when I've gone to talk into high schools, that's something that seems to be part of the confusion, is what really is emotional abuse in a dating relationship versus love, and jealousy being seen as positive. And that's understandable when you think of adolescence and dating as part of identity formation. And this is who I am, this person is with me. Interestingly, in our child welfare group, we found the adolescent females' risks were higher when they were dating someone older than 3 years. So if a teen is 15 and she's dating a male 18 or above, that confers a lot more risk because they're of adult age and have access to adult things. The males were actually dating females younger than themselves. So that's just something that we mightn't really think about when asking about dating, what the age difference is between the partners. The Youth Relationships Project is a evidence-based dating violence prevention program that is delivered in our randomized controlled trial to youth engaged in child welfare. And it's an indicated prevention program. And as Judy mentioned, The Red Cross runs a relationship prevention program called Respect Ed, and you can check out that website for that information. But this runs with a published manual. It is a 18 group-based program, 18 sessions that's run with mid-adolescents, because that's kind of the stage where they're already starting to date. But that's not to say, as practitioners, we can't ask about dating prior to actually beginning about dating. So prevention is not only happening when they are actually experiencing dating or actually experiencing dating violence. We include a male and female facilitator pair, and we have a wide range of interactive activities, including having guest speakers who've experienced violence, as well as, I think most importantly, learning about communication skills and practicing them. That's really the most critical element in the prevention program, is the behavior change. And to get behavior change, you have to teach the components of the behavior and have practicing of that behavior. And in doing so, you get to shifting the feedback from the environment as the behavior changes. And it's a process that kind of works in context. One of the other interesting things with the YRP program is that we had youth do some community involvement activities. So they took their experiences and their learning and became youth as experts, going out into the community, whether that was writing an editorial to a newspaper or doing a presentation section at a community resource center. They were the experts and were able to take on that role and again practice mastery of how we think about relationships and relationship skills. And what we found in the YRP outcome study was that it did decrease over a 2-year follow-up period self-reported dating violence. It also increased interpersonal competency, which you would expect when we're doing a program that's relationship-focused and relationship skills-focused. And also, unexpectedly, really, we had a trend towards decreasing trauma symptoms among these youth. We didn't target trauma directly, we targeted relationships directly. And research has shown that trauma symptoms is that kind of bridge mechanism between a lot of risk behaviors in youth, not just dating violence, also substance use and smoking behaviors. So we really do want to be sensitive to trauma symptoms, and we don't need to have PTSD as a disorder to want to target symptoms. And I think that's partly going back to where I started, where sleep comes in, because if you have hyperarousal or vigilance, that's definitely going to be part of the package that makes it difficult to, wind down, relax, and, enter into sleep, or our body's repair resilience system. So I just want to reinforce the key messages around relationships being a critical resilience vehicle and adolescence being an important window for prevention. The idea that skills are learned and really do need to be practiced, just targeting their attitudes is not enough. The idea that problem behaviors cluster together, and to see that more optimally, that when we prioritize mental health, we may be tackling a whole wide range of issues. And that there is a need for special attention and to risk groups such as those who are child welfare involved, just involved, street involved, presenting with mental health issues. There's a good review article now out in the Journal of Affective Disorders looking at the resilience factors for preventing adolescent depression and targeting on things like sleep. So very practical strategies. And the idea of learning to relate, that's an ongoing skill. There's no ceiling to our relationships skill base, in that in adolescence we have a real opportunity to prevent violence and support healthy lifestyle decision making. Thanks so much for your time and attention.
All right, thanks, Dr. Weckerl. That was, once again, a great presentation, really helping, I think, the audience really understand what the breadth of the issues are here. So we did have a question that came in, and again, my chance to remind the audience, type those questions in. It would be great to see what your thoughts are as the audience members, the diverse audience that we have. Please do type in your questions, and we'll get those to the presenters. But the question that has come in is from Angela, and it's quite long, so I'll read it to everyone. And I think it came in early in the presentation, probably during Dr. SD. But I think everyone, I'm hoping everyone can maybe contribute to this. Angela says she's working in a sexual health program in New Brunswick, and they provide services to youth within the context of the Consent of Minors Act that allows youth to access services without a parent's consent. And when she sees youth who would benefit from mental health services under the age of 16 years, currently the mental health service providers, predominantly provided by social workers who are not named in the current act, these children are unable to access mental health services if they're under 16. If nurses were available in the mental health youth program, because I'm assuming, she doesn't specify, but I'm assuming they are named, that nurses would be named in the act, they could operate within this act. Angela sees this as a significant barrier to youth in New Brunswick, and she's wondering if this is an issue in other provinces. She suggests the easy solution is to open the Consent of Minors Act, that's specific to New Brunswick, and to include social workers, which she thinks would improve access to mental health services for high-risk youth. Now, on the panel, we have folks from Alberta, Ontario, and Nova Scotia, but I'm wondering, is this an issue, children under 16 being able to access mental health services without a parent's consent?
Well, I think, the CYCC has a technology report, and certainly youth we know are online, and they are accessing mental health services online. And there's a lot of activity on looking at the evidence base of these kind of online programs, with some showing good evidence or promising. In Ontario, similarly, 16 is the kind of age. I think a basic message is the scope of mental health issues are far, far broader than there are, people available to deal with it. And so broadening that scope of dealing with, advocating for mental health services through many doors is important. And, I think equally as important is to get youth engaged in youth-to-youth advocacy. And one of the partners for CYCC is Mind Your Mind, and they provide some support around youth health seeking.
Yeah, and this is Dave, and I'm co-leading that report with the executive director for Mind Your Minds. But as Christine has said, through different forms of social media, youth are attempting to access mental health information. But there are some questions that need to be explored in terms of, for example, what type of mental health information are these youth trying to get? Is it for themselves? Is it for their peers? And it could be that they're actually trying to get information and understanding the mental health and well-being of their parents or significant others within their lives. I know from I teach in the Faculty of Social Work, and we've had in the last 5-6 years, well, probably the last decade, in terms of curriculum development, putting in more resources focused on children's mental health, because it's been an area that has been lacking. And our age in the province is also 16. So, but as we educate and practitioners, that's a way that we hopefully can open up doors to provide, or first of all, conceptualize and then provide effective services for these young people and their families as well.
This is Judy. Just to add on to that, I think Christine's points are really well taken. That I think the more that we can get more people around to help youth, the better it is for them. So I agree with that, and also with the social media and what is available through technology. I was one of the co-leads on the technology report, so I would really suggest to take that report and to just really see the different things that are happening around the technology and how that can also be used to support youth through some of these things.
And this is Dave again, and once again, as I said, we're working on a specific knowledge synthesis that hopefully will be launched in the next 2 to 3 months. And once again, that has a wealth of information in terms of what strategies youth are using to access mental health information. And the other research question that we're trying to tease out as part of this synthesis report, not only what strategies they're using, but what are the best pathways in accessing the information that they're seeking.
Yeah, that was a great discussion. I mean, really talking about, I think Angela was focusing on sort of formal mental health services, but great discussion about all of the other mental health services, peers, and everything else that children are engaging in and could be engaging. And a couple of references to the Engaging Youth with Technology Knowledge Synthesis report from the CYCC. We did do a presentation with CYCC on that. That was a couple months ago, I think, at least. But it is up on the CAPC Knowledge Exchange Network if anyone is interested in that. And you can always go to the CYCC network's website to find their other knowledge synthesis reports, which are all very excellent documents with lots of information and resources for everyone. And if the panel has any comments or questions for any of the other presentations that they've seen today, please do jump in. We don't have any other questions from the audience right now, but again, reminding the audience to type those questions in if you do have them. We'd be happy to continue this discussion. But does any of our panel have any questions for any of our other panelists?
Christine, I really appreciate your presentation on the dating relationships, and find it informs exactly what we have also found with our dating relationships. And this fall this spring we're bringing out a new program called Healthy Youth Relationships, and actually it will be doing peer-to-peer, the same as we've done with bullying prevention. So I think that all your findings are really critical and really do inform us on how to do this in the best possible way.
Great, thanks, Judy. And I'll just say to the audience, I mean, if you want any of those research articles or the references that I mentioned, you can email me at wickerc@mcmaster.ca, and I'm happy to provide that and answer any specific questions people have. And I would just, want to just reinforce that, resilience is something that practitioners have worked with and known, sort of whether they've explicitly labeled it as resilience. They've been in the practice of resilience because we're always working from the positive rather than trying to, solely focus on negatives or deficits or changing the negative patterns. It's a lot easier to add in new positive patterns. And I just wanted to really send out just that idea around how is really resilience in your practice in terms of like the day-to-day building of resilience. So while the YRP is a program, there's also this idea of day-to-day resilience strategies. And I think that's something that the CAPC conference the symposium will tackle. And it's something that as we prevention people are thinking of moving towards programming that really focus on the day-to-day behaviors.
And I think one of the pieces of those day-to-day behaviors is not only the day-to-day behaviors between, say, couples who are dating, but also the day-to-day behaviors of their peers around them, and the witnesses and bystanders of watching relationships that are aspiring into unhealthy landscapes. So I think that building on those skills that Christine talks about and building with all groups who are around the youth is really important.
And this is Dave, and I appreciate, in both presentations, because one of the themes was resiliency, and a key dimension of resiliency is strengths. And as a social work educator, it's important. It's important for us to. We know that people have problems. We know that people have issues. We know that people have challenges. But if the only message that we're imparting to young people and their families that they have deficits, they have problems, they have challenges, what does that do to their sense of who they are, their self-esteem, their sense of self-worth, etc.? What does it do in terms of their motivation to participate in programs and services? So we need to flip it around, and I think there are two major challenges for practitioners. First of all, we need to be able to assess. So what strengths, what gifts, what assets do you have and bring to any particular situation? And then the second is, once we've identified those strengths, how can we operationalize those strengths to help youth and their families get to a better place? So I agree with Christine's comments that we've got to take a more optimistic, a more positive approach rather than simply focusing on pathology, problem-oriented. Because from a practice perspective, you don't want to destroy the hope of people, and I think it's important to impart some positive messages and practices.
Sorry, go ahead.
Yeah, and part of the hopeful message is there are evidence-based practices. That's part of the hopeful message. This practice has worked for other youth, and it may work for you as well.
No, sorry, I didn't want to stop the discussion. I just wanted to say it was a great discussion and really sort of synthesizing some of the points that have been made throughout these presentations. Again, a chance to remind the audience. The audience is very quiet today. I'm not sure why. They're usually much more active, but not many questions coming in from them. So please, again, if you do have any other comments, very interesting, and any other comments, it's a very interesting discussion.
Yeah, it's a lot to digest in 1 hour, so I think all of us are happy to take your questions in our emails, and we'll look forward to responding to them in that way as well.
My email address is very, very simple. It's deste@ucalgary.ca.
All right. We did have a question just came in from Melody, and she's saying that she's in a small town of about 5,000 people, and they have a lot of youth in their community that are in dire need of prevention services. They don't have many services to offer. What would be the best starting point in getting a program started?
Bring the stakeholders together, including the youth. We've been hearing how much youth themselves are assets and talents, and there is financial support for youth-led initiatives, and to bring the people together and look for those fundings, Kickstarter, the Movember for men's voice health, those supports that are a little bit outside what you're normally used to getting your funding supports on.
And I would say is contact your nearest Red Cross office, because they're throughout the whole country, and there could be help through the volunteer base and through the Respect Ed program within the Red Cross.
And this is Dave. I agree. I think there needs to be community mobilization to bring, as stated earlier, the various stakeholders together, and as part of this process, provide both place and space for youth to share their views in terms of what they need, what's not going on in their lives, and what they feel would be helpful as a way of ensuring that they don't get into behaviors that are problematic.
I would also say go online, because there's other resources online that can help you, and you find them. So onto the Red Cross website, there's a whole variety of things that are out there with resources that can help you.
And Lisa, you wanted to make a comment?
Yeah, I just wanted to hop in, both as part of the earlier discussion around, how to do this work in a way that supports the development of resiliency amongst young people. And I guess just to echo, the power of bringing young people together to look at what's going on in their worlds and to identify, what would be, priorities for them in terms of supporting their, they'd probably call it something different, but their healthy community of peers. And I don't know the small town of 5,000. I assume resources are limited. And often youth can really identify what those key projects and initiatives would be, and then lead them. And they don't always, have to be resourced and are big ticket items. And then, trying to check in with the organizations that do have the evidence-based programs. So, another organization, depending on the types of priorities were identified. The Community Mental Health Association has chapters across the country. They also have the capacity to, provide program support as well. So I think that combination of getting the youth involved to help identify priorities and then looking to see whether there's evidence-based programs to implement are two key considerations.
All right, thanks, Lisa. We did get a question come in from Nav, who's saying that it sounds like there's a group of them around their line, that they're currently semester 7 students studying nursing. They are developing a change project on violence prevention.
I didn't hear that last part of your statement, Doug.
Yeah, sorry, I think someone's longer. She says they are developing a change project on youth-to-youth violence prevention. She says they're curious, is there a literature-based algorithm that exists to handle youth-to-youth violence in the acute care setting? Does anyone have any thoughts?
Well, I'm not sure if there's an algorithm and whether they're talking about medication or sort of intervention components, but I think that there is a lot of prevention programming for youth that maybe sometimes it's if there's nothing that you're finding is going over to another area, and how in mental health do they prevent violence on the ward, for instance, and things like that, and there's literatures in those areas, and they may be pulled over to the acute setting also, and you may be going into like the group home setting and violence prevention work that you have to have that keyword group homes or residential care, and you might find information in that way as well. That's sort of an information question.
Anyone else have any thoughts on that?
No, I don't have any.
No.
All right. We did have a question come in from Lori, who's asking, she says she's hearing a lot of buzzwords regarding community mobilization and use of strength. She's asking, what specific strategies would you recommend to create positive outcomes for youth?
Well, I think, a specific strategy for practitioners to have that process, because I think that's a process question, to create that process of positive outcomes. So a specific intervention strategy, a specific style of interacting with youth is motivational interviewing. If you Google motivational interviewing, you'll get to their main website, and that's a specific strategy to create positive outcomes. I mentioned about the importance of trauma symptoms. If those are present, then the trauma-focused cognitive behavioral therapy is a widely accessible intervention strategy. You can Google that and you can get free training online in that. So there are specific strategies. Having youth take an inventory of their strengths. One of the things that we've experienced with our child welfare studies is that, one, they didn't remember their birthdays because their birthdays weren't celebrated, so they didn't provide their accurate date of birth. Two, when we gave them a listing their top 10 fun activities to do, nobody got to 10. And often after like 1 to 3 would be probably most of what we saw. And after that, there were like basic functioning, eating, sleeping as your top 10 fun activity. So just asking youth to sort of be a bit reflective on what they're doing to add positive events in their day is a starter.
Yeah, I fully concur with those comments. As I said, I've worked a lot with immigrant and refugee youth and young black adolescent males, and there's a lot of negative stereotyping in terms of those two groups of youth, and once again, just getting a sense in terms of what do they see positive about themselves? What do they do well? Because I said earlier, it's so easy to dwell on the negatives, and if all we do with young people is dwell on their negatives, I think we're just pushing them into this cycle of the various types of violence that Christine and Julie presented in their work.
Yeah, and it's also the discovery process. The youth might not know what they're good at, and they have to have that opportunities in their community to try things out, try synchronized swimming, for instance, if they like the water at all. Maybe that, and that might end up being a career path. Yeah. Try if they'd have to try out going. It's a bit of facilitation for youth. Try to get them to have those co-op experiences in a restaurant to see if they're interested in being, in cooking. It's a life skill and it might be a career path. So we have to really partner with community resources and do some advocacy and peering for youth to really have that discovery process.
And the other thing I hear you saying, Christine, is not only the discovery process, but it's also the element of being creative and looking at different options and different pathways.
Yeah, and the advocacy part.
I think that discovery process is really important, and I just would like to reflect that one of the things we've learned is from our youth facilitators across the country. So we have over 5,000 youth facilitators across the country who are educating their peers on bullying prevention. And so many of those kids who have come in as youth facilitators have come in feeling really bad about themselves because they have been bullied. And some of them have been some of them have walked through the doors and said that they are very suicidal. And it's been quite intriguing to watch that discovery of their skills and as facilitators, and to take hold of an issue and begin to see that they can make a change with that issue within their other peers, so that they have the group support around that, has really been remarkable. And the impact then that they've had on their schools has been outstanding. So I think that there's lots we can learn from these kids who significant number have come in with some really bad experiences that have really pulled them down, and they've been able to turn that around. And what are the elements around them that have made them be successful in that?
Yeah, and if you want a role model, check out the CYCC homepage. they're advocating this concept of a mental health superhero, and that came from a youth, Alicia Raimundo, who had her own experiences and decided instead of having the stigma, I'm going to flip that and become a mental health advocate, view myself as a mental health superhero, because it is a lot of resilience to go through a lot of services and really engage meaningfully in that, ultimately a self-discovery, being the best version of yourself that you can be, kind of a process. And Alicia gave a TED Talk, and you can Google TED Alicia Superhero and find that short TED Talk.
Posted a follow-up comment to that question. She says she likes the strategies that you're mentioning for youth, etc. But she mentions many of the slides that were displayed talked about an ecological approach. She's asking, how do you engage the other stakeholders in the process of preventing youth violence?
So I'll jump in that first. I think there's a really interesting process that has been put out by the Social Innovative Review called the Collective Impact, which shows that how we can bring people together so that they come together for a common agenda and common measurements and the synergy that can happen, and also then the differences that can be celebrated. So I think that we absolutely have to bring all players to the table on this issue. I think that the children and the youth need to understand their rights and give all the opportunities to become who they are. But the adults and the organizations and the society around them have to make this a priority. And I think we start small. I think we start in the grassroots. We start in sports organizations. We start in youth serving organizations. We start in schools. We start small where we can make that impact and bring those people together on these issues. And then we build on it. And we keep building until we have a larger impact.
Yeah, and to find, the idea of being a participatory, find those champions in the schools, in the rec center, etc., and bring those champions together who are really prepared to take on the issues and work on the problem.
And this is Dave, and for me, it's even more fundamental. I think one of the keys is having the ability to begin to develop relationships with a cross-section of stakeholders, because I think as we build individual, collective relationships, sustain those, nurture those, pay attention to those relationships with a cross-section of community partners, I think that will be very helpful in bringing people together to address an issue or concern relating not only to youth but to any societal problem or phenomena. It's building those relationships that are absolutely critical and key. So it's a process and it takes time, but it's absolutely important.
Go ahead, Lisa.
And I just wanted to hop back in on the point around youth engagement, but also, it's the young people who can help map out what their ecology is, and if resources are limited, can really identify where the influences are coming from in their community and in their environment, and help you prioritize sort of who to engage first. Ideally, you engage the entire community, but if you need to focus. I think some of the most powerful youth workshops I've seen are ones have been able to reflect their world, and then have how their world reflected become part of the plan.
All right. Thanks, everyone. That was great discussion, and I think it certainly answered the questions that were asked. And with that, I think we are just about out of time. Another few minutes left, but that is the end of the questions there. So why don't I hand it over to the panel, maybe starting with
Judy, and we'll just give you a chance for any last final comments before we close off.
Well, my final comments is that I think that the prevention of violence is really a critical issue, that we all across, in whatever discipline or whatever community or wherever we are, that we have to grapple with this and bring it into our world. I think that our main job is to provide safe environments for our children and youth, and that we need to take this seriously and we need to move forward on this issue and know that because we now clearly understand violence and why violence happens, that we can prevent it. And so let's increase those champions out there, and let's just keep moving this forward so we can build safe communities.
All right, thanks, Judy. And let's hear a final comment from Dr. Chris Weckerell at McMaster University in Hamilton.
Well, my final comment is a big, kudos to everyone who's saw the title and have tuned in and want to tap into this topic area and are working in this area. It's a kind of often an unreinforcing area to work in as violence prevention because you don't get to see the quick wins. And I just want to just reinforce everyone for their persistence and recognizing and investing in this topic and seeing youth ultimately as, learners who are going to be lifelong learners, and the opportunities of adolescence to work on lifelong issues, issues that can have long impacts in both mental and physical health areas. So just kudos to all of you who have registered. We'll go online, we'll follow up, and have listened to us all in this hour.
All right, thanks, Dr. Weckerell. And let's go out west to the University of Calgary with the final comment from Dr. Dave Esty.
Well, once again, I just want to, my comments are similar to my colleagues. I think for the participants, the fact that you took time, your busy schedules, because I know everyone's exceedingly busy, greatly appreciated, and just keep on doing the good quality work that you're doing, because the work that you're doing as individuals, as part of teams or larger collectives, is making a difference and helping us to realize the dream that the youth indeed are our future in this country. So thank you very much for the opportunity.
All right, you're welcome. And finally, we'll go out to Halifax and our colleagues at the CYCC, Lisa Lachance.
Thanks. And so, in addition to thanking all the people who joined us, I want to thank our network members who led the panel discussion today. So thank you so much for continuing to bring your research and your expertise to our work. And I'd like to invite anyone who was a participant to have a look at our website, to consider, look at some of the topics we've explored, including violence prevention and coping with violence. And, we're always looking to augment our promising practices database. So if you're doing something in your community that you think works, you can also use our website as a way to connect with others doing similar work across the country. And and again, like others, if you have any questions, feel free to contact me.
Thank you, Lisa, for thanking our panel, and I'll thank them once again. It was a great conversation, great discussion, and I'm sure lots of people will be passing this presentation and the links on to their colleagues so that they can follow up and hear this. So thanks to our panel, and thanks again, Lisa, and the rest of our colleagues at the CYCC. It's always great partnering with you guys on this great content. It's always sort of the stuff that's on the fringes of our pure healthcare folks, but it's always the impacts and outcomes of these kinds of issues around violence and other mental health issues issues that certainly impacts our healthcare institutions and our hospitals, and they're always dealing with a lot of the outcomes. So they're always looking for ways to engage and be part of the solution and part of the prevention and all of that. So it's great to have these presentations from our partners at the CYCC network. And with that, we'll wrap it up. And thanks again to the audience for joining us. As always, we do these presentations on Wednesdays at 11 a.m. Eastern Time. And if you're looking for more information about our CAFC Presents series, you can go to our website at cafc.org. And hopefully you'll find something there that you think you would enjoy. Next week, we're going to hear from Marilyn Monk of the Hospital for Sick Children in Toronto and Peter Fitzgerald, the president from the McMaster Children's Hospital, are the board chair and vice chair of the CAFC Board of Directors, along with Elaine Orbine, CAFC's president and CEO, where we'll be launching the new strategic plan for CAFC for the next 5 years. So hopefully you'll join us there. And then we'll also have, following that on October 1st, we'll be having a presentation that will be of great interest to our colleagues in interfacility critical care transport, where we talk about the value of partnerships and collaboration, a journey toward quality improvement in interfacility transport. And as always, there is a calendar of upcoming webinars on the website, so be sure to check that out and make sure you get these in your calendar early so you don't miss them. All right, we hope to see everyone on our next webinar. See you then. Bye.
Bye, everybody.
Bye, everybody.
Bye. Thank you.